Orchitis is a medical condition characterized by inflammation of one or both testicles. It can result from bacterial or viral infections and is often associated with pain, swelling, and discomfort in the scrotal area. Orchitis can be acute or chronic, and its severity varies depending on the underlying cause and how quickly treatment is initiated. Understanding this condition requires an overview of its causes, symptoms, diagnosis, treatment, and potential complications. Causes of orchitis. Orchitis can arise from several different causes, including bacterial infections, viral infections, and sometimes autoimmune responses. One of the most common bacterial causes is Escherichia coli, which can spread from a urinary tract infection or through sexually transmitted infections, STIs, such as gonorrhea or chlamydia. In sexually active men, these infections are often the primary bacterial cause. Viral orchitis is frequently associated with the mumps virus. Mumps orchitis typically occurs in postpubertal males, as the mumps virus can affect the testicular tissue following infection. Vaccination against mumps has significantly reduced the incidence of mumps-related orchitis in developed countries. Other less common viral causes may include the Coxsackie virus or cytomegalovirus. Orchitis can also be secondary to epididymitis, an inflammation of the epididymis, the tube at the back of the testicle that stores and carries sperm. When the infection spreads from the epididymis to the testicle, it is often referred to as epididymo-orchitis. Symptoms of orchitis. The hallmark symptoms of orchitis include testicular pain and swelling. Patients typically experience sudden onset of pain in one or both testicles, which may gradually increase in intensity. The scrotum may appear red, warm, and tender to the touch. In some cases, swelling can become pronounced, making it difficult to wear tight clothing or perform routine activities comfortably. Other common symptoms include fever, nausea, vomiting, and general malaise, reflecting the systemic response to infection. Pain may radiate to the lower abdomen or groin. In viral cases, such as mumps orchitis, symptoms may also include swelling of the parotid glands, salivary glands near the jaw, headache, and muscle aches. Urinary symptoms like painful urination or increased frequency may appear if the underlying cause is a bacterial infection. Diagnosis of orchitis. Diagnosis begins with a thorough medical history and physical examination. The physician will assess the scrotum for swelling, tenderness, and warmth and examine the testicles for size and consistency. The presence of pain radiating to the abdomen or groin, along with systemic symptoms like fever, may provide clues about the severity and cause of the infection. Laboratory tests are often employed to confirm the diagnosis. Urine tests or urethral swabs can detect bacterial infections, including STIs. Blood tests may reveal elevated white blood cell counts, indicating an ongoing infection. Ultrasound imaging of the testicles is a valuable diagnostic tool, as it can help distinguish orchitis from other conditions such as testicular torsion, tumors, or hydrocele. Color Doppler ultrasound is particularly useful to assess blood flow and inflammation in the testicular tissue. Treatment of orchitis. Treatment of orchitis depends on the underlying cause. For bacterial orchitis, antibiotics are the primary therapy. The choice of antibiotic depends on the suspected or confirmed bacterial pathogen. Men with sexually transmitted infections may receive a combination of antibiotics targeting specific bacteria, and their sexual partners may also need treatment to prevent reinfection. For viral orchitis, such as mumps-related orchitis, antibiotics are ineffective, as they do not target viruses. Treatment focuses on relieving symptoms, including rest, scrotal support, ice packs to reduce swelling, and pain management with analgesics such as acetaminophen or nonsteroidal anti-inflammatory drugs, NSAIDs. Hospitalization is rarely necessary unless complications arise. Patients are advised to avoid strenuous activity during the acute phase and maintain scrotal support to reduce discomfort. Over-the-counter anti-inflammatory medications and hydration can assist in speeding up recovery. Vaccination against mumps is the best preventive measure for viral orchitis. Complications. If not treated promptly, orchitis can lead to significant complications. One serious consequence is testicular atrophy, where the affected testicle shrinks due to loss of tissue. This can lead to reduced fertility or even infertility, particularly if both testicles are involved. Chronic pain and scrotal discomfort may persist in some patients. Rarely, abscess formation within the testicle may occur, necessitating surgical drainage. Secondary infections can also spread, causing more systemic complications. Prevention. Preventing orchitis primarily involves reducing the risk of infections. Safe sexual practices, including the use of condoms, can help prevent bacterial orchitis caused by STIs. Timely vaccination against mumps in childhood or adolescence is highly effective in preventing viral orchitis. Prompt treatment of urinary tract infections and epididymitis is essential to prevent bacterial spread to the testicles. In conclusion, orchitis is a condition of testicular inflammation caused by infections, primarily bacterial or viral. Early recognition, accurate diagnosis, and appropriate treatment are crucial to prevent complications such as infertility and chronic pain. Supportive care, antibiotics for bacterial infections, and preventive measures like vaccination are key strategies for managing and mitigating the impact of this condition. With proper care, most patients recover fully, though attention to underlying causes and risk factors remains essential.